Good morning. I really enjoy answering questions that come along on our YouTube site, the Hospice Care Plan. People watch the videos and then it stimulates a question. They ask me and a comment, and I'm really excited to be able to give some answers back. This morning I got two questions regarding the medical directive of a hospice patient. Number one, have you ever come across a patient that hasn't died or that a physician doesn't feel meets hospice approval? And yes, I do evaluations all the time for patients to understand and evaluate whether they are actually ready for hospice care. And there's two things that come across. Number one, they don't meet criteria for hospice admission because they don't meet the criteria of being estimated to live 6 months or less, or they have a disease process that doesn't meet the criteria for that particular disease, and they have not followed along the path towards death far enough. And that's really the truth. We also have patients that don't meet hospice needs or the hospice admission standards because they choose out of their own personal goals, which of course they are welcome to, that they don't meet the goal for hospice. What is the goal for hospice? To live as long and comfortably as one can without invasive diagnosis or treatment, meaning that no going back to the hospital unless there's some acute injury, such as they fell and got a cut and needs to have sutures, that kind of thing. But their goal is to stay where they live and comfortably as long as possible, but not seek extraneous care to allow them to live longer. Many patients really meet the criteria for hospice. They are very ill, and I can look at them and say, yes, they meet the criteria. I don't expect them to live more than 6 months. The physician doesn't. They're very ill. They need intervention, and yet they really don't want to accept hospice. They're afraid of the word. They're not ready to say that their death is coming, and they don't want invasive care. Like, yeah, I still want to go to the hospital, or I still want someone to pump on my chest and give me one more chance. Those are the reasons that patients don't generally come onto hospice. They don't meet the goals from their own choices. They don't meet the criteria for admission. Thank you for asking. Please do so. Watch our videos and ask me whatever comes up. Go to our website, the Hospice Care Plan. We are there for you and all your hospice needs. Remember our motto: care is treatment.